As the world begins its slow return to global travel, airlines, airports and governments are looking at how to coordinate the data on the health status of passengers to allow them safer and more confident travel in the post-COVID world. Well, Alicante's Spain-based technology company Aviation has systems at work in more than 150 airports at 100 airlines worldwide, and it's now developed a platform that enables airlines, airports and governments to quickly vet a passenger's health status in advance of arrival, including analysing COVID-19 test results and vaccination status. The platform is being trialled at Manila Airport and Clark Airports in the Philippines, and we're joined now by Inc's CEO, Sean Richards, to tell us all about it. So Sean, tell us about this new platform.
Essentially, what it is providing a framework that allows the results that come out of labs to be transferred directly into the hands of those that need to see them and vet them within the airport. So that includes airlines, airports, ground handlers also need to be able to see this information because ground handlers are the ones who take care of the planes and the passengers when it's being turned. And then the other player in this whole puzzle of data handling are governments. So immigration and emigration, they need to know what is the status of passengers' health before they depart, and our system helps to do that.
So at the moment, we get a paper certificate that tells us that we've had a COVID test and we're fit to travel to a particular country. What's different then with what you're doing?
Well, the problem with paper, even though our company name is Inc., we're not really great fans of paper. The problem with paper is it can be forged. Increasingly, we're seeing cases that are occurring and being shown in the press where people are forging COVID results. And if the results that come out of a lab encounter the passenger before they encounter the authorities or the airport or the airline, there is just that opportunity for fraud to occur. What these digital passports enable is for this information about the tests and the test results to stay away from the passenger. So there's no vector that they can use to alter any aspect of it. So the integrity of it is much higher. And as tests become an endemic part of travel now, and everybody needs to have these tests, there will be more and more temptation for results to be doctored. The cost of tests are not particularly low when it's PCR testing, so the temptation is there. And the impact of this fraud is actually health. So we can see it's quite a difficult and important problem to solve. So the idea is basically you remove the ability for the passenger to change that data, but you still give them control of that data because ownership of the data is very important. Inc. as a data processor is not trying to own any of this data. What we're trying to do is join the dots between the people that originate high quality data and the people that need the systems that need to consume high quality data to ensure people's safety.
So in order to make this work, of course, you're going to need the health professionals putting in the initial data, and you're going to need governments and immigration to actually be involved in this. And I think we know at the moment there's not a huge amount of collaboration around the world in government systems. How are you going to get around that?
Well, economies need to restart. And as you said to me at the top of the piece, we need to bring confidence back into travel. In order for that confidence to return, people need to be assured about health. So you are increasingly going to get the need. It's almost like these governments are going to be driven by the demand to do this. The implication of not doing it is that you will be moving people who are potentially unsafe from one place to another. And as we know, the virus cannot travel internationally on its own. So we certainly need to make sure that we are evolving to be able to deal with this threat. And the way you do that is by communication.
So if we look to the future for aviation, as we get confidence coming back, do you see it contactless transit through airports, including all of this, the health checks, the passports, the boarding. Do you think the technology is up to it?
It certainly is. It's very hard to give a general answer and be specific, but this technology is not new. The technology for contactless, the technology for biometric processing is certainly not new. The industry has been, to a large extent, on the fence about it. You can go through some airports and see some biometric processing. There have been initiatives in the States and in the Middle East and so on, some processing out in the Far East. So you can see that it has tentative introduction into the process. However, it's not mainstream. The cost is not mainstream. The technology and how it integrates with, I would call them, legacy systems and legacy processes is not yet mainstream. But I think COVID is an extinction level event for aviation. So they have to choose. Organisms that live through huge shocks are never the biggest or the fastest. It's actually the ones that adapt best. And this is an opportunity for aviation to look at how it works and change some things. So the way that passengers themselves want to go through an airport, there's been a demand building for quite some time that they want simplification. It should be easier to book, easier to get through the airport, and the processes are kind of like interlocked. So it's not very easy to say, okay, let's bring in a new process. However, COVID kind of forces that. And instead of just introducing a touchless and a seamless process and it looks great and it's very spectacular, it has to be something that drives costs down.
Thanks, Sean. So a platform that could be coming to your cell phone sometime soon. Now, don't forget, we've got plenty of interviews, stories and analysis on vaccines, COVID testing, and indeed the whole passenger confidence issue on our website, wearefin.com. Thank you for watching.